Hello, I'm Dr. Stephen Garber. I'm an obstetric anesthesiologist in Orange County, California. I've been in practice for over 30 years, and I'm going to talk to you about the use of this syringe, the EpiFaith epidural syringe. The reason I really like this is because you do not have to have your finger on the plunger to help you find the epidural space. The way that it works is it has a spring mechanism in here. Once the epidural needle is in the intraspinous ligament, you then charge it, which means you have air or saline in here. You push it, it has pressure in here. So now you're advancing without having to press on the plunger, and when you hit the epidural space, there you go, you're in the space. It's going to show you you're in the space by that yellow indicator. It's great for patients with high BMIs, even patients that are very, very thin, where you're worried about the depth of the epidural space. You don't want to puncture the dura. So it definitely helps you decrease the incidence of dural punctures, and it's very useful in residents using the device to help them find the epidural space. I'm now going to demonstrate the use of the EpiFaith syringe with this phantom model of the lumbar spine. You can see it's a very adequate representation of the lumbar spine, and as you go in, when you hit the ligamentum flavum, there will be a loss of resistance. So let's go ahead and show you how this works. As you can see, I've placed the needle in the intraspinous ligament, and now we remove the stylet. I'm using saline in my syringe. I like to use saline. Attach it to the needle, and then we're going to charge the syringe, which means we're going to push it so the yellow disappears. At this point, I can advance the needle slowly. I'm going to advance it from the side just so you can see better. And I'm going to advance and watch what will happen as I continuously slowly push forward, look for the yellow signal to appear to show that we've reached the epidural space, and there it is. In this cadaver preparation, the epidural needle has been placed in the intraspinal ligament. The epidural syringe has been filled with air and is then placed onto the epidural needle and pushed so that the yellow is no longer visible. It's now charged. You're going to advance the needle, and you're going to be looking for the visual signal of the yellow to indicate that you have entered the epidural space.